जायचं बघा रे. कौन कर
पेसेंट बेडसाइड क्या
ए पेसेंट कौन हो
पेसेंट भल भल
ଭଲ ଅଛି ଏ ପେଟ କାଟିଆ କମିଲାଣି କମିନି ପେଟ କାଟିଆ
वो पेसेंट सार कौन असुविधा को जाना सार
central line in the femoral catheter left side we gave the patient because the normal venous cannulation was not available, so we went for a central line catheter. This is Charan, you can see our great Charan, and we gave the central line and we are now stitching the place. This is the central line, you can zoom it, open it, and we have bound it 2 stitch now, and the third stitch also put. This is the fourth one, and here we have given heparin injection, you can see. So this is a patient of CBA where the normal venous, it was because of this generalized edema, there was normal peripheral cannulation could not be done, so we went for that central line and it was successful. So we will be going for the fourth, that is fourth, our fourth stitch, last one stitch.
it goes to our sir.
The stage was now completed. So the first one, second one, third one and fourth one. The fourth is also completed. The central in situ, we can see. This is the fluid also going inside this our femoral vein. Femoral vein. Yes, you can bring some normal saline also. Okay. This is a clamp where will be, if the clamping is done, there the blood will not come in. Clamp karo chalo, clamp. So when the clamp is pushed, the blood will not come outside, and the clamp is just remove the clamp. Charan, clamp ready karo, clamp karo. And when the clamps comes out, the blood will automatically come from the femoral vein. Yes, you can see this is the blood. Okay, close it, close the clamp. Now we'll push some NS inside this femoral vein. You can see some NS is now ready to push inside this femoral vein. Yes. Open the clamp.
Okay.
So after opening the clamp, the NS will be pushed. This is the femoral vein. Yes. It is now easily going. You can see. So the femoral vein, femoral catheter it's a success. You can see. Yes. This is the last stitch also. If you put, I will be just tying it. Okay. Thank you. And this is Charan, and this is a successful femoral vein catheterization. You can see. This is the whole blood area. You can also show hand. After around 30 minutes, we have done this central vein catheterization in this ICU patient where the ventilator is already put. This is the ventilator where the patient is getting the air, and the femoral is now also successful. Thank you so much, Didi, also for this video. Behind the scene is Didi, our great Didi, and is a great Charan.
After all, my this video showing viewer are like, share, subscribe to our channel, Dr. Abhinash Mishra.
Okay, thank you.